Hi, Dr. GP. Our viewers want to ask few questions about their dental health.
Okay.
So the first one is it true that brushing harder cleans teeth better?
This is the most common myth: brushing harder cleans better. So, in reality, brushing hard can actually damage and cause more harm than doing anything good. Okay, like using hard bristle brush. Absolutely no. It wears down the tooth enamel. It causes gum recession. It damages your existing fillings, like composite fillings, veneers. What really matters is technique, time, and consistency.
Next question we have is that is it really necessary to use a mouthwash?
Okay, so mouthwash, think of it as a supporting tool and not a replacement. Basically, it depends upon the type of mouthwash. It can actually benefit you. Like for example, it freshens up your breath. It kills the bacteria. If you're using an antimicrobial mouthwash, then it can reduce cavities. It can help against protection against cavities if you're using a fluoridated mouthwash. Then it can also soothe sensitivity if you're using a desensitizing mouthwash. So it's not actually a replacement, but it's a supporting tool. That's it.
Okay, great, doctor. Okay, Dr. GP, the last question that we have here for you is how often should we visit a dentist if you don't have pain?
Great question. So, even if you don't have pain, it is still important to visit your dentist regularly because many oral dental issues like cavities, gum disease, and any early oral cancers can develop silently without even causing any pain. So, it is important to visit and consult your dentist regularly.
Thank you so much, Dr. GP, for all of your time.
Thank you.